Good morning, class of 2023. I'd like to welcome you into the clinical clerkship year of your medical school experience at the Larner College of Medicine at the University of Vermont. I'm going to keep my remarks short and personal. My name is Elise Everett, and my short bio is that I'm a GYN oncologist, a passionate medical educator, and a fierce hockey mom. I'm also the new level director for the core clinical clerkships, which means basically I oversee all of the clerkships here at LCOM. You and I are really beginning this journey together, as last year with the COVID pandemic, it was certainly not a normal year. And I'm hoping for you and I that this year is a much more normal clerkship year. So I'm really looking forward to hearing your feedback and watching you find your professional identity. Take a minute and write down 3 things that identify you today. And at the end of the year, I will ask you to do this again and share your before and after remarks with each other. Medicine changes you. As I went to write these remarks, I remember the moment I decided on my career path. I was at an outreach obstetrics and gynecology clinic rotation in Spokane, Washington on my last clerkship rotation. A gynecologic oncologist from Seattle had come to our site for the day to see patients. I spent the day in awe of this physician's rapport with patients, her surgical acumen, her clinical judgment, and she was an athlete, a musician, a wife, and a mom too. From that moment on, I had my mentor, I had my vision, and I set out on my journey to find my professional identity. As I write this here today, I think I have been successful, and I hope that each of you will have an amazing professional journey. And I'm so excited to get to share part of that journey with you. I hate to break this to you, but you have completed the science part of the curriculum, and that is the easy part. Now you're going to see that science is applied to each individual patient and discover the art of medicine, which is a lot more challenging. There is not always going to be a right answer, but rather the right answer for that patient at that particular moment in time. However, if you always put your patients first, you can never be wrong. Your world is about to get a lot bigger, and the emotions and stressors you are going to experience are going to be beyond your imagination. You're going to discover the calling of medicine, the privilege, the honor it is to participate in patients' lives in these enormous moments, the delivery of a baby, news of a cancer diagnosis, ringing the gong after finishing chemotherapy regimen, and holding a patient's hand as they take their last breath. Cherish and respect these moments, learn from these moments, teach from these moments. This is a marathon, not a sprint. This is not about work-life balance, but more about work-life harmony or work-life integration. Go into your clerkship with clear eyes, a full heart, and put the patients first, and you can't go wrong. I look forward to seeing you on the wards.